Good afternoon. Thank you for joining us for the Government of Newfoundland and Labrador's COVID-19 update for today, Saturday, February 13th. Special thanks to members of the media as you are working long hours throughout this to keep the public informed, and we really appreciate it. Given the current level of public health emergency in our province, these briefings are an important touch point as we work to contain this latest outbreak. With that, I'll turn things over to Dr. Fitzgerald.
Thank you, Premier. Good afternoon, everyone. Thanks for joining us today. I'll begin with an update. So since the media briefing yesterday, we have 26 new confirmed cases of COVID-19 in our province. 9 under the age of 20, 2 between 20 and 39, 9 between 40 and 49, 3 between 60 and 69, 3 over 70 years of age. The total number of cases in our province is 686. There has been 1 new recovery since yesterday in the Western Health Region, leaving 285 active cases in the province. No one is in hospital due to the virus. 1,618 people have been tested since yesterday, for a total of 89,065 tested to date. As announced last night, the B.1.1.7 variant that was first recognized in the UK is the COVID strain responsible for this outbreak in our province. We know that this variant spreads faster and easier. It is estimated to be 70% more transmissible than the original COVID strain, which explains the rapid explosion of cases this week. What is not known is whether the variant strain causes more or less severe illness than the original strain. And while the vast majority of cases in our province have been mild or even had no symptoms, this could be because most of the affected individuals are young. Our greatest concern is how this variant could impact seniors, particularly those in congregate living facilities. We have therefore escalated restrictions to protect these individuals. All personal care homes, long-term care facilities, and assisted living facilities in the province must suspend group activities and activities for residents outside of the home. Visitation is limited to 1 essential visitor for those residents who require one. An essential visitor is an individual considered by the residents' care team to be paramount to the residents' physical care and mental well-being, including assistance with feeding, mobility, personal care, communication assistance, or assistance with significant behavioral symptoms. Ensure residents who are admitted from community or acute care they must undergo screening, testing, and isolation prior to admission to the home or facility. Anyone who enters the home or facility must be screened before entry. Staff must only be shared with other homes or facilities in urgent situations where direct care of residents will be adversely impacted. And residents must be monitored daily for signs and symptoms of COVID-19. Remember that we all possess the tools and the ability to protect against this virus and stop the outbreak. First, we know that the vaccine protects against the variant, and regional health authorities continue to administer the vaccine to priority groups as shipments arrive. Second, we know that the same public health measures we have been practicing throughout the year will protect us now. Your non-medical mask is a critical layer of protection for yourself and others. Wear it whenever you're interacting with people outside of your household bubble, not just in indoor public spaces. Your mask should be at least 2 layers, but 3 is better. And make sure it fully covers your nose and chin. Do not wear a face shield in place of a mask. Washing your hands destroys the virus on your skin, so wash your hands well and often, or use a hand sanitizer with at least 60% alcohol. Maintain at least 6 feet distance from others at all times who are outside of your household bubble. Respect directional arrows in stores, and you should only have close physical contact with those in your household, or if you live alone, with the household you have joined with. Now is not the time to bend the rules or take chances. Last night, our province moved swiftly to Alert Level 5. We applied the lessons we have learned since these levels were developed last year, and in the last 24 hours, we have made further amendments to our special measures orders. For greater certainty, I will detail the key restrictions. All private clinics must close immediately, with the exception of physician and nurse practitioners. Closed clinics can offer urgent and emergent care, and virtual options can be offered for non-urgent care. Wakes and visitations are prohibited. Funerals, burials, weddings, and religious and cultural ceremonies are limited to no more than 5 people. With the exception of a single-person household joining another household, all gatherings are limited to those individuals within the same household. Under Alert Level 5, anyone who is not self-isolating should stay home as much as possible and only leave your house to buy essential goods such as food and medicine, or to go to work if you are required to be physically present. For those who are not self-isolating, outdoor activities with your household, such as walking and hiking, are encouraged as long as physical distancing can be maintained. For all individuals required to self-isolate or quarantine, they must remain on their own property or stay in their own unit where they are living in a condominium or apartment. These individuals are not permitted to use common spaces of that building. They must not go for a walk or drive unless it is to receive urgent medical attention. If you are not yet COVID positive, but have been advised to self-isolate, do so away from other members of your household. If you cannot isolate away from others, everyone in the house must self-isolate together. If you are COVID positive and self-isolating, that changes things. And in this case, the whole household must self-isolate together. And if you are an essential worker and have an individual in your household that is COVID positive, they need to self-isolate in a separate location and not in the same house. If you are identified as a close contact of a positive COVID case and your test was negative, you must continue to self-isolate for 14 days until you last had contact with the individual. Effective immediately, we are also amending the requirements for Canadian rotational workers returning to the province from non-outbreak sites in Canada. They must now self-isolate away from families for 14 days and are not able to avail of a test on day 7 or modified self-isolation. Any rotational workers who have recently returned to the province and have not yet received their day 7 test will not be able to receive it and must start self-isolating away from family members immediately. There are no changes for international rotational workers and workers returning from international sites or known outbreak sites who must still self-isolate for 14 days away from their family. The Canadian Red Cross is available to assist anyone who does not have a place to self-isolate, or those who are in self-isolation and need help accessing essentials such as food and medication. If you need support, please contact the Canadian Red Cross Self-Isolation Helpline at 1-800-863-6582. I know that there is so much fear and anxiety right now. If you are calling 811 for advice, please have patience. You will have to wait to speak with someone. Please do not call 911 unless you have an actual emergency that requires police, ambulance, or fire department response. If you require a COVID test, please use the online assessment and referral tool on our website. Depending on where you fall in the priority groups, it may take several days to get a call back. If you or someone you know are experiencing a mental health crisis, please call the Provincial Mental Health Crisis Line at 1-888-737-4668 to speak with a mental health clinician. This service is available 24/7 to anyone who needs it. If you are feeling anxious and alone, you can also call the Provincial Warm Line at 1-855-753-2560, 7 days a week from 9 a.m. to midnight to speak with a trained peer support worker who is there and ready to listen. You can also visit bridgethegap.ca to access age-appropriate programs and services that are available locally, confidentially, and free. If you are experiencing violence, do not hesitate to reach out for help to the Domestic Violence Helpline. The province-wide toll-free number is 1-888-709-7090. Remember to listen to local, current, and trusted sources of information. These include the Department of Health and Community Services, the regional health authorities, Public Health Agency of Canada, and the World Health Organization. As a recap for those who may have just joined us, we have 26 new confirmed cases since yesterday's media advisory. The total number of cases in the province is 686. We all need to keep the faith, stay strong and determined. We fought an outbreak before knowing much less about the virus than we know now. We can do this, and we will do this. So hold fast, Newfoundland and Labrador. Thank you.
Well, thank you, Dr. Fitzgerald. After last night's news, I'm sure it was a long, restless night for a lot of us across Newfoundland and Labrador. Moving back to level 5, the highest alert level, feels like a giant step backwards, but it's also a big step forward in terms of containing this outbreak. And there are two things I want you to keep in mind. First, Dr. Fitzgerald, Dr. Haggie, and I are working diligently with our teams to help guide the province through this tough situation. Second, we will get through this. We've done it before because of your collective efforts. I ask you to please do it again. Be extra vigilant. Wear your mask, wash your hands, keep your physical distance, and respect the bubbles. I can't stress this enough. Now is not the time for gatherings. Limit your contacting right now is crucial in the control of COVID-19. And please, download the COVID-19 app. This morning, I spoke with Indigenous leadership. We heard their concerns and will continue to work with them to ensure Indigenous communities stay safe. I also ask you to keep your local businesses in mind. If you can, this is a great opportunity to order some contactless takeout from a local restaurant or curbside pickup from a local store. Try your best to be positive and do a mental health check with yourself and those around you. Safely get outside on this pleasant winter day in some areas, and stay safe, be kind, and calm. I'll now pass it over to Dr. Haggie for some brief comments.
Thank you very much, Premier. Again, day 343, and we still, fortunately, have nobody hospitalized as yet as a result of COVID-19 any longer. I just want to pick up on a few threads from Premier's comments and from Dr. Fitzgerald, and from some comments brought to me by MHAs and staff. We have encountered, unfortunately, some situations where the wait at testing stations have led to some unfortunate comments from clients waiting to be tested directed at healthcare staff. I really understand the frustration, but cannot excuse those kind of comments or that kind of behavior. And I would just like to reiterate both all of our comments in the past that the only thing we should be spreading is kindness. In terms of the federal picture, I have had two conversations with the federal minister, Minister Haidu, who has been extremely forthcoming and supportive. She has offered both in-kind and financial support to the Department of Health, should it be needed. And certainly we'll work with her and her staff to identify any gaps we might see where she can help us fill. From the point of view of the regional health authorities, they have all announced significant changes to visitation across acute and long-term care facilities now. And I expect over the course of the next 36 to 48 hours, there will be further announcements around planned and routine procedures and outpatient visitations. Emergency services continue, cancer treatments continue, chemotherapy continues. We have never been in a situation, unlike some other jurisdictions, where we've had to curtail that, and it is not our intent to go down that road at all. Dr. Fitzgerald mentioned supports around mental health, and we've repeated these on numerous occasions. One that hasn't featured for a little while is the issue around isolation support. If you have challenges getting isolation accommodation, or once in isolation you have challenges getting food or essential services, the Canadian Red Cross is here to help you. And I think it's worth repeating their contact number. It is 1-800-863-6582, and they are staffed and ready to help. We have been here before, and we have moved on from here before. And we did it by following the same public health messages that Dr. Fitzgerald is now suggesting they worked then, they will work again now. The special measures orders are clear instructions as to how individuals, businesses, and entities should behave during the pandemic, and they should be observed not just to the letter, but also in the spirit of their intent. For information, we have seen misinformation pop up very quickly in this circumstance in the past. Please go to the trusted sources that Dr. Fitzgerald has referenced. And I would close by echoing again her comment. Keep the faith. We can get through this. Thank you very much, Premier.
Well, thank you, Minister Haggie. I'll now turn to media for questions.
Thank you, Premier. For the benefit of our speakers, there are 6 reporters registered for today's call. The question and answer session will be conducted in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have 1 final question. Our first questions are from Peter Cowan with CBC. Please go ahead.
Dr. Fitzgerald, I'm wondering if you can explain the rationale for the change for rotational workers. If the concern right now is virus spreading within the province, why are we imposing those additional restrictions on rotational workers?
So we know that the virus, this strain is, and other strains as well, but certainly we know this strain is present in other jurisdictions in the country, particularly in 2 jurisdictions where a lot of rotational workers come from. And so we certainly cannot take the chance of more introductions of this strain. So we know that we've had some conversations with our colleagues across the country, and we've we understand that some people may not test positive until after day 7, and at this point we really just can't take a chance on missing these cases. So it's unfortunate. We hope we won't have to keep it in place for long. We hope we'll be able to find a better solution as time goes on, but for right now, this is what we're going to have to do.
And I have a question about vaccine supply. Nova Scotia said this week that some of theirs has been diverted to northern communities. Have we seen any of our supply diverted? And in light of this outbreak, has there been any discussion with Ottawa about increasing our supply of vaccines?
Certainly, I'm not aware of any of our supply being diverted, and at this point, we haven't. Vaccine supply is certainly something that all jurisdictions are concerned about, and we're not the only one experiencing an outbreak. We're not the only one who have community cases of the B117 variant. So, we haven't had those conversations at this point.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. Dr. Fitzgerald, you noted at the beginning of this briefing that the public health measures we've been following for quite a period of time now will continue to work against this variant. Yesterday, you noted that this virus or this variant is also more transmissible. Should we be doing more than 6 feet apart? Does it stay on surfaces a bit longer? Should we be taking other extra precautions?
So, to the best of our knowledge right now, it doesn't seem to last any longer on surfaces than the original strain. And with regard to staying further apart, there's no clear evidence on this at this point that it makes any difference. I mean, certainly, we recommend physical distancing. So, if you can stay further apart, so much the better. But certainly, we still recommend 6 feet at this point. Some places had gone down to 1 meter or 3 feet, so we've always recommended the 2 meters or 6 feet physical distancing.
Thank you. And we also know that many of the health authorities have implemented visitor restrictions. This also extends to going back to the birth protocols that we saw nearly this time last year. There was a lot of grief that was brought up over that, mental health goals. Have we looked at changing that just slightly based on what we've already learned?
Was that for me or for Minister?
Probably for Minister.
Yeah.
Either of you.
Sorry, it kind of falls into the intersection of acute and public health.
Yeah.
The challenge with this virus is it only moves when you do. And unfortunately, people moving into and out of acute care facilities is another source of potential spread. We have seen devastating effects when the virus, the older strain, got into facilities in Alberta or in Toronto. And we just can't take that chance either at this present time.
Thank you.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. Dr. Fitzgerald, some essential places will remain open in alert level 5, such as grocery stores. Are we considering bumping up workers in these essential businesses to get the vaccine sooner?
So at this point, our focus has really been on trying to control the spread of this virus, to get testing done, to focus on testing. We will be looking at our vaccine protocols, but I can't, we haven't had those discussions as of today.
Okay, and this may be a question that's best suited for the Education Minister, but Premier, maybe you can shed some light on it. I know that when the Metro outbreak first started, the delivery of Chromebooks to rural areas were diverted to Metro to help with the transition to online learning, but now schools across the entire province are shut down. Where are we with ensuring that all students have proper access now that we're transitioning to online?
Well, I know that the minister and the school district are working hard to solve this, so I will provide an update as soon as I know.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Hello, good afternoon. Happy Saturday. The number this morning, I believe, today was 26. Does that include the cases that you reported last night, other than beyond what was reported in the afternoon?
Yeah, that includes the 9 that we said we had between the 2 media briefings. Yes.
Okay, thank you. And purely from a public health perspective, are there any restrictions on people with respect to who can go to mailboxes? I'm thinking of people in isolation, people in quarantine. This is obviously going to be a major issue with mail-in ballots.
So, technically people are supposed to stay on their property, and they can't really leave their property. So, I guess that's not my issue to problem solve, but, it will have to be something that will be looked at, I guess, with regard to mail-in ballots.
Okay, thank you.
Our next questions are from Danielle Edwards with the Canadian Press. Please go ahead.
Hi, I think this question is best directed to Dr. Fitzgerald, but I just wanted to ask, because I've noticed that over the past few days, the cases have actually dropped quite quickly. Is there any idea as to the exact reason as to why there's been quite a reduction in the cases? Would you say that it would be the pretty harsh restrictions that were placed on the province?
So I am not reading anything into our numbers at this point. It's still too early. We did a lot of testing we recognized that there were some kind of larger spread, I won't call them super spreader, but larger spreading events that happened over last weekend with students who were playing sports or attending some social gatherings together. So we found a lot of those students very quickly. We tested them very quickly. So of course our numbers are going to be very high at the outset. And now we're seeing, contacts of these students, or maybe some of these students who weren't symptomatic initially have now become symptomatic. We may be starting to see more just non-epi-linked cases out there, just people who are coming in who are symptomatic. So it's really difficult to say at this point what the drop in the numbers mean, and I don't think we should read anything into it. At this stage, I think we just... we'll continue to see cases. I think that really big jump that we had with, in the beginning was because we were doing testing in a group that we knew, that had a very high chance of being positive. So I think we're going to certainly see numbers for the next several days for sure, numbers like we're seeing now.
And I also wanted to ask about the Eastern Health Region. I know that there were recently some visitation restrictions placed. Is there a threshold that the province is looking at to reinstate visitation rights for patients, well, for people who want to visit patients in hospitals and long-term care facilities?
Minister?
All chipping in here. I'll take a stab at it. The short answer is that as the epidemiology in the province changes, certainly we're prepared to look at that. For those of you back in April, I think it was, as we went from alert level 5 to 4 to 3, you saw a relaxation of the stringency of hospital visitation in line with the easing of restrictions generally in the community. But again, you have a safe hospital by having a safe community and vice versa. So the two are inextricably linked, and at the moment, Dr. Fitzgerald has advised and insisted that this is how it be done, and we'll operationalize that.
Okay, thank you.
Our next questions are from Patrick Butler with Radio Canada. Please go ahead.
Hi, Mr. Haggie. I'd like to ask you a question about surgeries, elective procedures, testing, diagnostics, things like that. You mentioned that emergency procedures have been affected, but for all those other sort of things that you might go to the hospital for, are those operations being affected by the current situation?
They will be, and the exact nature of that will be down to a combination of public health advice, occupational health and safety advice within the individual facilities, and the clinicians to prioritize patients in terms of whether or not their visit or surgery can be deferred or should be deferred or needs to go ahead. So those discussions are taking place at the moment, and further announcements will be made as each facility and each RHA comes to a consensus.
And the last time we went into this scale of a lockdown, there was quite quickly an increase in the wait list of procedures, of backed up procedures. In the time since, I guess, when things went back to normal to now, were we able to get rid of those wait lists, or are they still higher than they would have been before the pandemic?
Certainly from the point of view of the patients waiting at the time the pandemic was declared and the initial level 5 was instituted, that backlog has gone. For reasons of the way the system works, most wait lists are actually held in private physicians' offices and not shared with the regional health authorities until maybe about 2 to 3 weeks before their procedure is scheduled. So we've been working with the NLMA to try and get a handle on what those numbers are, but certainly from the point of view of common sense, there will be an increase in people waiting. We have had, as yet, no evidence to suggest that this has had a deleterious effect on the health of the public and outcomes at large. But again, quite frankly, that data has not been analysed in any great way. But again, we're working with the NLMA so that we can see what they're holding in their private offices.
Thank you.
Our next questions are from Peter Cowan with CBC. Please go ahead.
I want to ask about testing. I've heard from people who are frustrated because they are waiting days and days in order to just get an appointment, and let alone an actual test. How many people are waiting for testing, and where is the bottleneck here? Because I notice we are still below the 2,000 tests a day that the lab has the capability to do.
Minister, do you want to take that one?
Yeah, certainly. We are looking to see where that bottleneck is, quite frankly. We have a triage system which allocates testing priority, testing sequence based on public health guidelines as to who is a more likely carrier or victim, as it were, of COVID. And those are fairly clear. If you're someone who's symptomatic and has been in contact with an individual who's positive, you're not going to wait very long for your test. I think one of the challenges is, as we spread the net very wide, in terms of asking people on location basis, for example. That's generated quite the demand. And I know there are discussions about using alternate methods of testing, such as the rapid test kits and the kind of outbreak equipment that we have available. So the short answer is I'm looking into that, and I have not yet had a definitive answer.
Thank you. And I'm wondering, Dr. Fitzgerald, can you give us a sense of how is the virus spreading right now? We knew early on it was groups of young people. We are now seeing more people in other age groups. Are these generally close contacts of existing cases? Are we seeing a lot of cases where we have no known source? What do we know right now?
So to the best of my knowledge, and of course this is evolving fairly quickly with the people on the ground, and I'm not involved in all of the day-to-day case management. So, but it appears that it was teens, it's family members now, parents, siblings, and. That seems to be, for the most part, the case. We have had some unlinked change of transmission in there that we're still trying to look for a source. But by and large, that's the trends that we're seeing right now.
Thanks.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. A lot of people wondering about childcare now and what will remain open, what is to close, because when we were in Alert Level 5 last time, there was a lot of confusion around childcare centers being opened and then what children could go there.
Certainly we're having those discussions with the Department of Education and Early Childhood Development we certainly need to protect our essential workforce, so we'll be having some clarification on that in the next 24 hours.
Thank you. This kind of piggybacks on that, and I know it's mainly an education question, but a lot of teachers wondering if they are still required to go into schools to provide online learning. And then the double-edged sword of that is if you've got childcare centers open for essential workers' children, they're not necessarily being able to do the online learning. So I guess a lot of confusion around where the direction is here, and if you've spoken to the NLESB about advice on how to go forward.
Right now this is an evolving situation, and the Minister of Education is working with the with the school district to try to find solutions in consultation with Dr. Fitzgerald and public health advice. I know people want answers now, and I can feel the uncertainty that exists, especially with daycares and education, but we'll provide those answers as soon as we get them for you.
Thank you.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you, and this is a bit further to Peter Cowan's question a little bit earlier on backlogs. I'm hearing of backlogs being created at the testing sites because some people are showing up without an appointment to try to get tested. Are we considering restricting access to these sites in any way to make sure that only those with appointments have access?
The Minister?
Yeah, that's a good question. We have had people doing that. One of the reasons that we are doing the system the way we are in terms of scheduling appointments has been to try and minimize traffic and congestion because of the transmission issue. But the other is to try and limit the testing to those who actually need it and for those for whom there is a significant public health benefit. Kind of random testing of the population has not been done outside of clinical trials. There is, an idea that we need to perhaps have some kind of crowd control or traffic control, and certainly we have explored the issue of traffic control through Eastern Health. Obviously, we haven't quite got it right yet, but we're working on it.
Thank you. And Dr. Fitzgerald, what are the restrictions right now and rules for parents with shared custody of children? What should they be doing?
Certainly the intention of these orders was not to interrupt any custody agreements or arrangements, so those would continue. The child obviously would stick with each household bubble when they were in each of those household bubbles.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Hi. I'm wondering about renovation. I think this was an issue last year. Are people allowed to continue home renovations?
If they follow public health guidelines, I'm assuming. Yep.
Yeah, I have to be honest, Peter, I haven't gotten down that far into the weeds about things, but, you know, we're just trying really hard to respond as quickly as we can here now. But, I mean, obviously, if things are continuing and it can happen, you know, within, if you're doing it yourself, certainly if you have the equipment, you can continue to do it. And I guess it depends on the type of home renovations. I certainly don't think I would want somebody from outside my bubble coming into my house to do work right now, unless it was absolutely essential. You know, life couldn't go on without it.
But if you're at home if you're at home by yourself, Peter, with a paintbrush halfway down a wall, you can still continue.
Yes,
I
you
think
can
it's safe to
absolutely
say.
continue to paint.
Yep, these are just questions we're getting.
Yeah, I know.
No. Yeah, no.
Totally understand. It's just, you know, we haven't gotten there yet.
Yeah. Last spring, there were several bouts of financial assistance being offered to people who were affected by the lockdown. Can we expect anything along those lines again?
Well, we're certainly looking at all options available to us. The Deputy Premier and Minister of Finance will be looking at all options available to support the businesses that have been impacted and the individuals that have been impacted by this current shutdown. Again, this is early in the situation and quickly evolving, so we will be providing an update as best we can as soon as we can.
Okay, thank you.
Our next questions are from Patrick Butler with Radio Canada. Please go ahead.
Just on that last point, Mr. Fury, you know, we are still in an election campaign. Is it possible that yourself could be handing out money on behalf of government, you know, during a campaign? Is that a possibility?
No, I mean, that's certainly not the desire, but we're in a very different situation right now, and whatever we did would be abiding by the legislation and would be only in an emergency situation. So hopefully we get this under control and contained quickly so that these measures aren't required.
And Dr. Haggie, you mentioned your conversation with the federal health minister. And that Minister Haidoo talked about in-kind and financial support from the federal government. What would that look like? Yeah, what does in-kind and financial support mean?
Well, there was talk of Canadian Red Cross or pandemic response personnel. We've already, through public health, I think, discussed having access to epidemiological support in excess of what we currently have. The financial piece was around, maybe isolation housing and that kind of thing. So a whole raft of options, and really she was extremely helpful. And I think we just need to go back internally now and see what gaps we feel we have that we need to fill. Currently, we're not aware of a pressure for isolation housing, for example, nor are we aware of pressures that would require us to bring in Red Cross personnel from other jurisdictions. So the offers are there and the support is there, which is more than welcome and very much appreciated. How that translates into what we use, I think, depends on our needs on a given day.
And that's, of course, very consistent with the message delivered by the Prime Minister and Minister LeBlanc last night. I know Dr. Fitzgerald's also been talking to Dr. Tam, and the assurances of the federal government being there for an urgent, emergent situation are given. and the Prime Minister is fully supportive of the people of Newfoundland and Labrador and helping us navigate through this tough situation.
I will now go back through each reporter to see if you have one final question. Peter Cowan with CBC, do you have a final question?
I do, and this one is probably for the Premier and Dr. Fitzgerald. Premier, you mentioned that you talked to Indigenous leaders about their concerns. We're hearing a lot of concerns from folks in Labrador about the fact that travel is still allowed within the province to different areas without testing, without isolation. So what measures are you looking at? And Dr. Fitzgerald, are you looking at bringing in any additional special measures orders that might limit mobility?
So that we did have a really fulsome, good call with the Indigenous leadership throughout the province, including, of course, the Indigenous leaders in Labrador, and that was raised by all leaders. Frankly, Dr. Fitzgerald was on the call, and so we heard that loud and clear, and now Dr. Fitzgerald's committed to taking that back and having a look following public health advice and her team's advice about what is possible and what is necessary, balanced and measured against the current epidemiology in the regions.
Yep. I would agree with that. There's not really much more to say at this point.
Okay.
Kellyanne Roberts with NTV, do you have a final question?
Yes, thank you. We know there's a lot of testing stations and mobile stations being set up in the metro region, but many people outside of the metro region needing testing as well are having to drive more than an hour and a half to receive those tests, which might deter a lot of people from getting tested. Are we looking to increase testing sites outside of the metro region?
The short answer is yes, if need be. One of the challenges is at the weekend, for example, in Central, they tend to just maintain a couple of centrally located test sites simply because of staffing. Bearing in mind the demand there has actually been very light until recently. Obviously, that's an operational issue, and that's been brought up with the CEOs through the Department of Health staff. So we can certainly look at the demand for scheduled tests and make sure the resources match.
Thank you.
Richard Duggan with VOCM, do you have a final question?
Yes, Dr. Fitzgerald, I know that once again today we've seen a decrease in our numbers, and I know that earlier you said that you don't want to read too much into those numbers, but given how contagious this strain is and how widespread our testing has been so far, is it at all concerning to you that we aren't finding significantly more cases?
I mean, at this point, we are finding cases that we're looking for, which is really good. I mean, it means that, our contact tracing is doing what it needs to do. The fact that we haven't seen a significant number more cases popping up that, are ending up in hospital and finding cases that way, that's a good sign. But as I said, we really can't read a whole lot into these numbers, and so we just have a blanket level of concern right now. So, we're just waiting for more information and to see what happens as time goes on.
Thank you.
Peter Jackson with The Telegram, do you have a final question?
Yes, I do. Dr. Fitzgerald, assuming we get beyond this particular outbreak, and given the transmissibility of this new variant, do you foresee that our new normal will look a little bit different well into the future?
Well, again, it's difficult to predict, but certainly I think with the bottom line is right now, these variants are a part of our lives, period. Not just because we have this outbreak, but because they're floating around everywhere in the world. So we need to really consider that any case could be a variant case at any time. So that does have to heighten our sense of caution that we have to use when we're out in public and interacting with other people. And so I do think we have to take that as a lesson going forward.
Thank you.
Patrick Butler with Radio Canada, do you have a final question?
Yeah, I do. Dr. Fitzgerald, just trying to square two of the measures that you announced. A maximum of 5 people at funerals, burials, and weddings, and then limiting gatherings to just your own bubble. Does that mean that funerals, gatherings, and burials are only limited to your own bubble? Can you just explain that a little bit better?
So basically, any gatherings that's happening should be with just your household, right? If you are having a funeral or a wedding or any other kind of cultural ceremony where you may be interacting with people outside of your bubble, household bubble, then there can only be 5 people there.
Thank you, everyone. Premier, do you have any final comments today?
Well, thank you, everybody, for joining. I know this is an anxiety-provoking time for you and for your families, and that's okay. That's normal. We will get through this. I want to thank, again, the media for helping us deliver this news to the people across the province. And I want to thank, again, frontline workers. But I also, Newfoundland and Labrador, this is our time. This is our time to respond. We've responded before. We will respond this time, and we will get through it. Just follow Dr. Fitzgerald and her amazing team's advice. We will get through this. We will come out the other side. Be kind and remain calm. And thank you very much.
Thank you, Premier. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.
Our smartphones. We use them to keep in touch, to play, and to work. Now, your smartphone can help you limit the spread of COVID-19. Someone can have COVID-19 and not know it. They can spread the disease before they have any symptoms. The Government of Canada has developed an app that will let you know if you may have been in contact with someone who has tested positive for COVID-19. The COVID Alert app creates a random code so that no one will know your name or your location. The app uses Bluetooth to exchange random codes with nearby phones. The code is a randomly generated string of digits and letters that changes every 5 minutes, so it cannot be used to identify you. The app does not have access to your name or address, or your phone's contacts, your location, or your health information. If someone you've encountered later tests positive for COVID-19 and uploads to the app a one-time key they received from their healthcare authority, you'll be notified that you may have been exposed. If you test positive for COVID-19, you can upload your one-time key from your healthcare authority. The app will then notify the people you've encountered without revealing your identity. You can then take steps to limit the spread of the disease. If you know you've been exposed, you should contact your local public health authority and follow their instructions. Using the app is one more thing we can all do to help limit the spread of COVID-19, in addition to washing our hands, keeping 2 meters apart, and wearing a non-medical mask or face covering when it's difficult to maintain physical distancing. You can do your part by downloading the app today and helping others use it too. The more